At 76, I could barely walk across my living room without excruciating joint pain. Then my neighbor Martha shared her miracle mixture, a specific combination of castor oil and Epsom salt. Within 2 weeks, I was gardening again. I've since discovered this same mixture helps with 10 different health problems common among us seniors. Let me show you exactly how to make it and use it for each condition. Now let's explore the 10 health problems this remarkable mixture can help address, with specific instructions for each. Problem number 1. Joint pain and arthritis. For joint pain and arthritis, create a warm castor oil and Epsom salt compress. Mix 3 tablespoons of castor oil with 1 tablespoon of dissolved Epsom salt until it forms a paste. Warm the mixture slightly, never hot. Then apply to painful joints using a cotton cloth or flannel. Cover with plastic wrap to prevent staining, then place a heating pad on a low setting over the area for 20 to 30 minutes. Apply this remedy 3 to 4 times weekly for optimal results. Most seniors report noticeable pain reduction within 7 to 10 days, with significant improvement after 3 to 4 weeks of consistent use. Robert applied this to his knees every other night before bed and noticed that his morning stiffness had decreased by 70% after just 2 weeks. Problem number 2. Constipation and digestive issues. For digestive concerns, there are 2 approaches. Note that internal consumption of castor oil is not recommended without medical supervision, especially for seniors. Instead, try this external application. Mix 2 tablespoons of castor oil with 1 teaspoon of Epsom salt dissolved in a small amount of warm water. Apply this mixture to your abdomen in gentle clockwise circular motions for 10 to 15 minutes before bed. Cover with a warm towel afterward. This gentle massage stimulates the digestive tract and can promote regularity within 24 to 48 hours for most seniors. If you have a sensitive digestive system or inflammatory bowel conditions, reduce the Epsom salt to 1/2 teaspoon in the mixture. Consistent application 2 to 3 times weekly helps maintain digestive regularity without the harsh effects of many laxatives. If you don't have castor oil, I've added a link to a trusted one on Amazon below this video or in the first comment. Problem number 3. Dry skin and eczema. Our skin thins and becomes drier as we age. Create a therapeutic balm by mixing 4 tablespoons of castor oil with 1 teaspoon of Epsom salt, fully dissolved in 1 tablespoon of warm water, and 1 tablespoon of coconut oil. Apply to dry, flaky areas using gentle patting motions rather than rubbing, which can irritate sensitive skin. For extremely dry areas, apply at night and cover with cotton gloves or socks if treating hands or feet. To avoid irritation, always perform a patch test first. Apply a small amount to your inner wrist and wait 24 hours to ensure no reaction occurs. Many seniors find that twice-weekly application dramatically improves skin hydration and reduces itchiness associated with eczema flare-ups within 10 to 14 days. Problem number 4. Muscle soreness and cramps. For muscle soreness and those painful nighttime leg cramps, create a therapeutic bath by adding 1/2 cup of Epsom salt and 1/4 cup of castor oil to warm, not hot, bath water. Water temperature should be comfortable, approximately 100 degrees Fahrenheit, 38 degrees Celsius, as seniors' skin is more sensitive to heat. Soak for 15 to 20 minutes while gently moving affected muscles through their range of motion underwater. This gentle movement helps the mixture penetrate more effectively. For targeted relief of a specific muscle group, try a warm compress with 3 tablespoons of castor oil and 2 teaspoons of Epsom salt. This bath remedy is particularly effective when used within an hour after physical activity or before bedtime to prevent nighttime cramps. Problem number 5. Insomnia and sleep problems. Many seniors struggle with sleep issues. For better rest, create a sleep-promoting treatment by mixing 3 tablespoons of castor oil with 2 teaspoons of Epsom salt, dissolved in a small amount of warm water. Apply this mixture to the soles of your feet about 30 minutes before bedtime. Then put on cotton socks. Additionally, gently massage a small amount of the mixture on your temples and behind your ears. Complement this with deep breathing exercises. Inhale for a count of 4, hold for 7, and exhale for 8. Repeat 5 times while the mixture absorbs. This approach works through reflexology principles and the calming effect of magnesium absorption through the skin. Most seniors report falling asleep more quickly and experiencing fewer nighttime awakenings within 3 to 5 days of starting this routine. Problem number 6. Peripheral neuropathy. Symptoms. For the tingling, numbness, and discomfort of peripheral neuropathy, create a specialized foot soak by dissolving 1/4 cup of Epsom salt in a basin of warm water, then adding 3 tablespoons of castor oil and stirring well. Soak feet for 15 to 20 minutes, then without rinsing, gently massage a small additional amount of castor oil directly into the affected areas using small circular motions for 5 minutes per foot. Focus particular attention on the balls of the feet and around the toes where neuropathy symptoms are often most pronounced. For optimal results, repeat this treatment 3 times weekly. Many seniors report reduced tingling and improved sensation within 2 to 3 weeks of regular use. Problem number 7. Inflammation and swelling. To address inflammation and swelling, especially in the lower extremities, the application temperature matters significantly. For acute swelling with heat, use a cool application. Refrigerate your mixture of 3 tablespoons of castor oil and 2 teaspoons of dissolved Epsom salt for 30 minutes before applying. For chronic inflammation without heat, use the warm application method described earlier. While using the compress, elevate the affected area above heart level using comfortable pillows. Maintain this position for 20 to 30 minutes during treatment. Measure improvement by noting changes in your ability to see ankle bones or knuckles, or by marking swelling levels with a non-toxic pen and observing changes over time. Most seniors notice reduced swelling within 48 to 72 hours with twice daily applications. Problem number 8. Minor wound healing. As we age, our skin heals more slowly. While you should never apply this mixture directly to open wounds, it can significantly enhance the healing environment of surrounding tissue. Apply the mixture, 3 parts castor oil to 1 part dissolved Epsom salt, to the skin surrounding a wound, keeping at least a ½ inch distance from the wound edges. This improves circulation to the area, bringing healing nutrients and removing waste products. Cover the surrounding area with a breathable bandage after application, leaving the actual wound dressed according to medical recommendations. Signs of improved healing response include reduced redness in surrounding tissue, decreased pain, and a more normal skin temperature near the wound. Application twice daily typically shows results within 5 to 7 days. Problem number 9. Fungal infections. For addressing common fungal concerns like athlete's foot or nail fungus, create an antifungal mixture with stronger Epsom salt concentration. 2 tablespoons of castor oil mixed with 2 tablespoons of Epsom salt dissolved in 1 tablespoon of warm water. Apply directly to affected areas after thoroughly cleaning and drying. For nail fungus, apply the mixture and cover with a breathable cotton sock. For other areas, leave the mixture on for 30 minutes before rinsing with warm water and thoroughly drying. Maintain scrupulous sanitization. Wash hands before and after application. Never reuse cloths or applicators, and launder socks and bedding in hot water. To prevent recurrence, address environmental factors by keeping affected areas dry, wearing breathable shoes, using fresh socks daily, and applying the mixture preventatively once weekly after successful treatment. Problem number 10. Stress and tension. For stress reduction, create a self-massage oil by mixing 4 tablespoons of castor oil with 1 teaspoon of Epsom salt, dissolved in a small amount of warm water. Apply to tight muscles using firm but gentle pressure. For maximum benefit, focus on these pressure points: the base of the skull where the neck and head meet, the fleshy web between the thumb and index finger, and the center of the inner wrist. Combine with controlled breathing while applying. Inhale slowly through your nose for 4 seconds, hold for 2 seconds, then exhale through your mouth for 6 seconds. This activates your parasympathetic nervous system, enhancing the relaxing effects. A 15-minute self-massage with this mixture before bed can significantly reduce stress hormones and improve your sense of well-being within minutes. If you don't have castor oil, I've added a link to a trusted one on Amazon below this video or in the first comment. Important medication interactions to be aware of. This mixture, particularly when used extensively, may interact with certain medications. If you take blood thinners or anticoagulants, the increased circulation from this treatment could potentially enhance their effects. For those on blood pressure medications, the relaxing effects of magnesium might amplify blood pressure reduction. Diabetic patients should monitor glucose levels carefully, as improved circulation can occasionally affect insulin absorption rates. Those taking heart medications, particularly digitalis derivatives, should consult their doctor, as magnesium can interact with these medications. To minimize potential interactions, avoid applying large amounts of this mixture within 2 hours of taking oral medications, as it could potentially affect absorption rates. Real success stories from seniors. Margaret, age 82, had suffered from arthritis in her hands for decades. After using the joint pain application for 1 month, she regained enough dexterity to resume her beloved knitting hobby. "My hands still have arthritis, but the pain is manageable now without so many pills," she reports. William, 75, struggled with leg cramps that regularly disrupted his sleep. After 2 weeks of using the muscle remedy before bed, he now sleeps through the night without painful interruptions. "It's like a miracle," his wife shares. "He hasn't slept this well in years." Dr. Elizabeth Chen, a geriatric specialist, notes, "While we need more clinical studies, I've observed significant quality of life improvements in patients using these traditional remedies appropriately. The anti-inflammatory properties of castor oil combined with magnesium's muscle-relaxing effects make scientific sense." When not to use this remedy. Do not use this remedy if you have open wounds, skin infections, or allergies to either ingredient. Always perform a small patch test first. Discontinue use immediately if you experience rash, increased pain, itching, or any unusual symptoms. These could indicate an allergic reaction or other adverse response. This remedy is not a substitute for medical care. Seek immediate medical help instead of trying this remedy if you experience severe or sudden pain, significant swelling with warmth and redness, or symptoms that worsen despite treatment. Conclusion and next steps. The simple combination of castor oil and Epsom salt offers remarkable potential for addressing multiple health concerns that commonly affect seniors. If you found this information helpful, please share it with friends and family members who might benefit. For more science-backed natural remedies specifically designed with seniors' health in mind, subscribe to our channel. We're committed to helping you maintain your independence and quality of life through practical, affordable solutions that really work.